What you probably didn't know, we're going to have a little fun now. So this is our interactive part of the day because we're all freezing probably. And so this is a good way to get the blood pumping. And this is an opportunity to kind of use all the tools we've learned, our aim statements, our PSA cycles, our run charts, all those sort of things, and kind of put it together in a very simple exercise and have a little challenge for you. So before we get started, I'd like everybody starting at this table, if you'll just count off 1, 2, 3, remember your number because that's really, really important. But if you'll just start off and go around the room. Challenge. So this is a very serious event. I want to let you know that. Been asked by your local health department to develop a highly reliable process for rapidly spreading contact of a new antiseptic, which is administered person to person using a red ball. Now, unfortunately, we weren't able to get the red balls on the trip from America to New Zealand. They actually became a little pinkish. So we have pinkish balls today. But only casual contact of a person's hands with the ball is needed to assure antiseptic delivery. And the challenge is really, really simple. You have to find the fastest way to have the ball contact as many people's hands in the shortest amount of time. And the challenge is opened up to teams made up of equal number of members. So these are the rules. Ball must touch both hands of each participant, and, even though it's not written, the participant must be in control of the ball solely. So, and you'll have copies of these rules. So in other words, you can't just touch the person's hands with the ball. They actually have to have control of the ball. Even for a millisecond, they have to have control of it. Person does not have one or both limbs. A portion of that participant's body must be touched at least one time each cycle. And they must be in control of the ball again. Fastest time to touch both hands of all group participants is the desired goal. You must use group space allowed. If a ball comes into contact with the ground prior to touching both hands of all participants involved in the group, the process must start over for all participants. So you have to start the entire process over. There's no eavesdropping on other participants' sessions. We don't allow you to steal and learn from other participants. Penalties and curveballs may occur at any time within the game at the discretion of the referees. You may not physically alter the shape, color, or surface of the ball. I apparently have already done that for you. If a member of the team drops out, you must use another member twice to equal the number of members on the other team. And a PDSA must be completed in between each cycle, or an extra 10 seconds is added to the group's time. So this is a timed event. And again, we're going to have aim statements. We're going to have some measurement. And we've already included your metrics for you already. And then we're going to also look at normative group processing, driver diagrams, and PDSA cycles. So if you'll go ahead and break up into groups, right now, we will go ahead and get the game started.
On your mark, get set, go.
Group 1, 14.50 drops. Group 2, 15.34, no drops. Okay, group 3. Any drops? No drops. Wow, that's great. Okay, well, that's pretty good, but what if we had some tools? So now what we're going to do now, we've actually made up some tools, and so one of those tools is, you now have all the tools that we talked about. So we're going to have an aim statement. We're going to have enough material so that you can do normative group process. We're going to have a driver diagram, and we're also going to have run charts. So you're going to collect your data. And there's two types of data you're going to collect. One is error data, so how many times you drop the ball. And another one is, the other type of data is your time. So you'll be interesting to know you're doing very good on your time. And then we're going to follow those data points out over time. So you're going to have about 10-15 minutes to actually come up with your aim statement. So your aim statement's basically completed for you, but you just have to make a prediction. How much by when? So the reason I took you through the exercise first without allowing you to see an aim was I wanted you to kind of understand and make some predictions about what you think the future is based on your current experience, okay? And then the next thing is you have some metrics. So the two metrics, just so everybody knows the rules of the game. Metric 1 is the number of seconds to complete a red ball antiseptic delivery process, and it's seconds per cycle. And metric 2 is the number of errors per cycle, and errors per cycle is just a count, so it's a whole number. And you're going to annotate those on the grid. Your aim statement, I have a sample driver diagram here if anyone's interested in it. That you can use, but you can also make up your own driver diagram. So I just included that in case you want to use a different use a cheater driver diagram, if you will. There's a team name and member list, so if everybody puts their team name and members, you don't have to do that really, as long as you just put team 2, 1, 2, and 3. And then for your group ID collection board, remember the normative group process, we have two basic frames. One is reducing errors and improving speed and efficiency. That came off the sample driver diagram. You then have a grid, and so you can put up the ideas of things you want to test, and then test those things. Here's your PDSA template, and your data sheet for your run charts. So basically, you have about 15 minutes to complete your aim statement. One caveat, in between each cycle, there's going to be a very short amount of time to complete a PDSA cycle. If you do not complete a PDSA cycle, you will incur a penalty of 10 seconds added to your time. So, and like I said, curveballs can occur at any time, so go ahead and get started. All right.
Go. Any drops? No drops. Team 1, 9.73, no drops. Team 2, 7.1, no drops. Team 2. Next test. Every person on the team must be paired with another person, and you must stand back to front like this. On your marks, get set, go. 13.04, very good compared to last cycle. Yeah. Team 3.
13.43, no drops.
With no drops. For 3. Okay, on your marks.
Concentration.
Get set. Go. All right, ladies and gentlemen, just to let you know, we've had another change in environmental conditions I need to inform you about before the next test, which is going to commence in about 30 seconds. So I'll be turning around to you. Team 1, 10.18, no errors. Team 2, 10.05, no errors. Oh, Team 3 missed the boat. So unfortunately, you go to the baseline, which means you have to see. Okay, go, ladies. All right, Team 3, report out.
11.61. Pretty good. 11.61, no errors.
Okay, and then if you guys can go back to your seats.
All the groups did really, really well. You're very innovative and very creative. Had people on chairs doing a funnel. I don't think I've ever seen that before. That was really, really kind of interesting. So what do you guys think of the exercise? I'm going to ask you a couple questions. What did you learn about each other? How about competition? Did that make any difference? How about your built space? What about the space you had to operate in? Were there any obstacles you encountered? How clear were the rules? Right. How clear were the operational definitions? Did they change over time? What about those changes in environmental conditions? How much impact did that have on your group? How many environmental, show of hands, or people can just shout it out. What environmental condition changes did you observe during the game? Some were pretty obvious, some maybe not so obvious. Okay, back to back. Oh, getting really close to people. What were some other things that happened during the game that changed the environmental conditions? Got warmer?
People had to stop talking. Some people had to stop talking.
Okay. And then how about the water or the sanitizer that was poured on the ball? Oh, they dried. This team took the sanitizer off the ball, which kind of, probably, who knows? Maybe the ball doesn't work any longer with the sanitizer off. But anyways, so there's lots of things that change over time, and the point of that, the reason that we throw curveballs into this game is because, one, did it get a bit boring and predictive when things were just going along? Yeah. The game start to not be much fun anymore? Yeah. And that's usually the case. QI work, there are periods of time when it gets really, 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 really boring, and you got to kind of shake it up a little bit. What did you learn about innovating? Was the first solution you came up with, was that the final solution that you had the most success with in the end? Did anybody dominate the conversation in groups? Were there any leaders that stepped forward that were kind of surprising? So those are some of the things you'll see when you do not only games, but you'll see when you do improvement work. Sometimes the leader isn't the person with the title. The leader is actually the person with the most knowledge about improvement science or the most knowledge about that particular area. So again, you need that subject matter knowledge and you need that improvement knowledge. So those two are really, really important. And the whole point of improvement, when you're doing improvement work, it's really important to be sensitive to subject matter knowledge experts. Our role is not to question their subject matter necessarily. People are experts in their field, and many of them have legitimate issues with various protocols and things like that. So, if you encounter resistance with that out there, try to understand why. What is the evidence base? You might have to go back to that. You might have to involve more experts to gain consensus. So those are really important things. So did everybody have some fun? Did you feel afraid of failure? Did anybody care if they failed? Yeah. What if this had been a real exercise, though? What if we were implementing a new protocol to reduce ventilator-associated pneumonias? So, again, the point is that, remember when I said you can simulate things? Sometimes you can't use a patient because it's too risky, or you might get into trouble doing that. So we don't want to expose our patients to harm necessarily, but you can use a fake patient and you can possibly simulate part of that as much as you possibly can. So think creatively about ways you might simulate things. You might simulate a patient experience, or you might not have a patient available. We will frequently use ourselves as staff members. One of the exercises, how many people have read the Dartmouth Green Book? Are you familiar with that? Dartmouth Green Book for Clinical Microsystems. So there's a really great exercise in that. It's called Through the Eyes of the Patient. Sometime if you work in a surgery or work in a ward or something like that, I know the time is precious, check yourself in.
have yourself put an armband on, a gown on, get on the gurney, roll all the way back to the OR, and watch what happens, and have everybody treat you like a patient. It's a very interesting experience. It's life-changing, frankly, for most people. You see all the people that are interacting. What is really interesting is you'll be really proud of the team you work with. But the other thing you'll notice is you'll notice a lot of things from a patient's perspective you never thought about. So again, you can simulate a lot of these experiences and learn a lot in the process, and that's how you get the ideas that lead to change. Okay. How many people found writing out PDSA cycles to be a little bit challenging? So, any challenges with that? Like recording the PDSA cycle? How many people tested the whole cycle as a PDSA, and how many tested it on just 2 people and time between 2 people or 3 people? How many? Whole cycle? How many people did you all use? Smaller mixes with smaller groups. So again, the whole point of PDSA cycles is you can break down stuff into really small elements. So if you might not be able to simulate an entire cycle, but you can you can divide your process into 20 parts, or you can divide it into those 20 parts in your process chart, and you can actually start to look and just test those elements. So when you do PDSAs, how many PDSAs did each group do? How about group 1? How many total PDSAs did you do? Written and unwritten. How many would you calculate that you did? 15 PDSA cycles. 15. 13, sorry. Rock and roll as a kid. Okay, team 2, how many cycles did you guys do? Small test, still on? Yeah, so at least 9 and maybe more, because you get penalized if you weren't. I know that's kind of mean, but I mean, that's the way we run the game, unfortunately. And team 3? 12? Okay. So the point is that PDSA cycles, a lot of times what I'll see groups do when they're doing an improvement cycle is they'll kind of wait and do one big PDSA almost. And the whole point of PDSA is it's kind of like the way when you were a kid that you learned how to stack blocks and make them not fall over. So you tried some little things for a while. You didn't take up the whole group and try to stack the whole thing at first. You built little tests of stacking those blocks at first. And then you gained some confidence that, well, maybe I can stack further. And so you went a little bit further with it, and a little further and a little further. And eventually, not the first time, but usually within a couple days, you're stacking the entire kit of blocks all the way as high as you could go, because you built up, what you were basically doing as a child is you were doing PDSA cycles. You were learning, you had a theory about what you were doing, you were testing your theory out, didn't work, back up, get frustrated, take the other way around, and go on and on. So PDSAs are actually part of, it really is just a mirror of how we formalized it. And the reason we formalize it is so you have a record. So you can look back when you have a little bit of time and things start falling off, and you can kind of get a record of what you did and why you got to various areas, and you can also do that over the chart. So one of the things we're going to do is we're going to have each group look at their run chart. So can I have a representative from group 1? Okay, so Janice is going to present the data. So when you look at Team 2's run chart, what do you see? What does their data tell you? What story does this data tell you?
Want me to say anything or?
Okay, so obviously we don't have a median line. We could draw a median line if we wanted to, but we can maybe do that at lunch so you can kind of get an idea of where your median is. Now, I want to point out this dot right here. Can everybody see that dot? I know it's a challenge because we're a long ways away. When you see that, what do you think? Remember your run chart rules? Which rule is that?
Outlier.
Astronomical data point. Does everybody pretty much agree with that? Compared to the rest of your data points, pretty much out there. You see how it's a matter of opinion, and that's the point with that rule. So astronomical data point is a rule. So what happened with your astronomical data point? Do you remember?
You gave us an extra rule.
Oh.
That we had to, so we had to change our whole process. We had a process that we'd improved on, and then something there was a rule change, and there was disorganisation and confusion, and we needed quite a bit of testing to overcome that.
Does that ever happen in your hospital?
Always.
Yeah. So exactly. QI is messy. The game changes constantly. So, what happened, what actually happened, one of the things that did happen here is that we were speeding up. Some of the environmental things we changed during the game is we changed the amount of time you have in between cycles because, you don't get unlimited time. You got to work on the airplane while you're flying the airplane a lot of times while you're doing QI. So that's what's a little bit different with quality improvement. But what do you think about this data right here? What does that start to look like? How's the variation there?
Minimal.
Now, we didn't talk a lot about this, but look over here. Look at the way I set up your data. And I set this up deliberately, but it's really hard to see the change. You know why? Because your scale over here is so large. Because I set your baseline at 65. When you saw that baseline of 65, that when you think in baselines, and I was really proud of this group because what will happen in some groups is they'll start to compare themselves to the baseline, and when they get the baseline, they stop improving. We do this all the time in healthcare. We use baselines and we say, hey, it's great. 5 errors, that's a baseline. We're under the baseline, we're fine. Okay. But what tends to happen when that happens is innovation really kind of drops off very, very quickly because there's no more challenge. You got to your goal, if you will. So I'm always cautious. Deming really cautioned healthcare executives and leadership and leadership in general to really avoid taking out the intrinsic motivation that people have to improve and be better than they thought they could be, and systems to be better than they ever thought they could be. So I would just challenge you with that. Be careful about baseline data. It's a baseline. Just because everybody else does it that way and has achieved that level doesn't mean you might not do better. It might not be worth it. Sometimes there's a law of diminishing returns, but you have to make that decision, for yourself and with your patient. So thank you very much, Jan. I appreciate it. Thanks. Great job, Team 2. The other rest of Team 2's data, and I'm not going to go through these, but because we didn't have a lot of drops. But when you look at drops, again, I also influenced you. I told you that the baseline drop was 1 per cycle. So not many people paid attention to that. And so sometimes we really emphasize that in the red ball game, but where there's a lot of baselines. And so just something to keep in mind. And most of our teams did a really, really good job, not holding themselves to some baseline. They just went ahead and got what they want. Okay, Team 1. Okay, how much do you want to hold up I'll hold up your data for you. So this is seconds. All right, so this is Team 1's data. So can everybody see this data? How does that data look, just visually? What story does that tell you about Team 1? What do you think of when you think about them? Consistency? Pretty reliable? Were they the best overall in terms of time? And I use that as a qualitative thing. Did they achieve the very best time? How about if we added all their seconds up and compared it to all the other teams, though?
Yep.
Probably so. So something can be said about doing something very consistently and reliable. So reliability, we would predict that their system would stay as long as there weren't a lot of other environmental challenges. They did have an environmental challenge right here. And so there was a little stress put on their system, but it's a pretty durable system is what you can say about their system. Okay? Make sense? So when you're looking at data, your data tells a story. You see lots of variation in the data, there's stuff going on. There's stuff going on in collection, there's stuff going on. Here, things are a little simpler, but if you start seeing things and all things being held equal with your data, this data tells a really powerful story, and you can go back and you can talk to teams. Tell me about this data point. Tell me about what was going on here. If they can't explain what it is, there's something going. There has to be something going on there. If you have like an astronomical data point. So if you have a rule, if you have a special cause, most teams can tell you what is happening or what's going on, what's changed. If you don't have a special cause, you have common cause, you'll get a plethora of ideas and concepts and reasons for what's going on in the data. But basically there's no difference, statistically speaking, from one data point to the next. It's all common cause variation. It's just stable variation. So very good. Great work. Thank you. Thank you very much. So Team 3, can you tell me a little about some of the challenges you all faced in your game?
Changing the rules. we do have on our chart, I think it's about cycle 6, where we didn't actually complete the task within the time frame. So that's why we've got the dot up there, but we're fairly all right, I think.
So what do you think about when you look at Team 3's data? How about this dot right here? What would you call that? Okay, so we have a special cause. What was your special cause?
We just didn't get it done in time.
Just didn't get it done in time?
Yeah.
Okay, so ran out of time, couldn't get it done, got penalized? Yeah. Okay.
That's it. Yeah.
All right. So if we take that dot out, and this is kind of a lesson when you're building a baseline. Let's say that you weren't quite ready and you're trying to build a little bit of baseline data. Don't be afraid to kind of take a dot out to start normalizing your baseline. In general, if you're trying to see if a change is occurring and you just had a fluke in your data, you can go ahead and there's a way that we can take some of that data out. You don't have to include it because you don't want that to, especially in a formal run chart, because it can really influence your mean. So you want relatively stable data in your baseline unless it is really unstable data all the time from point-to-point collection. So the more stable that you can collect a few baseline data points, again, it's a baseline. It's supposed to be relatively stable. The variation in the data, at least, is supposed to be relatively stable. That might mean that you have 1 point up here and 1 point down here, but the pattern remains pretty stable. Make sense? It doesn't have to be a flat line. It doesn't have to be a flat line, the baseline. But it needs to be, the pattern needs to be relatively stable. It needs, even if it's unreliably unreliable, if that makes sense. But if you have all reliable points and then you have one astronomical data point, really go back and look at that and say, was it something doing with collection? Did we just not collect it? Did we not start? Did we get penalized for not collecting in time, or some of these sort of things? And so that's the whole point of this exercise, is to kind of take you through in an area where the risk of harm to anyone is really low and nobody minds failing, and allow you to kind of see what you might be going back to in the real world. Okay? Any other things you learned from your data?
Not to drop the ball.
Not to drop the ball. Yeah. Boy, big penalty there, eh? Okay. Great. All right. Thank you very much. Okay. So I think I'm juggling mics here. I think we're getting ready to start lunch pretty shortly. Right now? Okay, Avril's telling me now, which means hush up. But again, I just want to thank you all very much for participating in the game. Any questions before we wrap up today? Oh.
Yeah, this one over here.
Aha, you must be from Team 2. Okay, so Team 2 want to know the quickest. The quickest is actually right around 4 seconds. Roughly the same amount. We try to always have about, if you want to do this game in your own organization, please make use of the slides. Like I said, everything that we have here, feel free to steal and share shamelessly. I don't have any real, I don't have any monetary gain in red ball games, so it's just a game. But if you want to use it in your organization, you want to have between 18 and 25, and there's 25 people in a group. When it gets bigger than that, it gets really cumbersome and the group can't participate. So I don't remember exactly how many people were in that, but they did manage to get around the group.
All right.
Yeah. Yeah. So 18 to 25 is a generally good size for a red ball game. It's a great way to, break the ice and have fun and do some learning as well.